Hi, everyone.
Hello, everyone. So we're starting the session one more time with Dr. Ranjan Ghosh. He's an MBBS and MD from the US, American Board Certified in Adult and Pediatric Psychiatry. So we're going to start talking about and discuss about dangers of mood disorders today. I welcome everybody, and I would like Dr. Ranjan to start. And
Yes. First of all, I'd like to thank SATS Academy and the forum, the HCP forum, because I think that it's a very valuable thing that they're doing. Mane ei je shikkata, mane even lockdown এর সময়, unlock এর সময়, whatever যেটা তোমরা আছো, যেটা তোমরা করছো at least, এটা আমাদের ব্রেনটা চালু রাখা খুব জরুরি. So we really need to keep our brains going. We need to keep our educational system intact as much as possible. Therefore, I've also made upgrades to bring people closer. And I do this for a living. Now I do mostly online consultation. So before I get to know somebody, I'd like to see their face. Jeta offline, if you come to my premise, it's by invitation only. I have to really know what's going on. Ebong mukhosh korte hoy. So কেন এটা করছি, I promised before I did any lecture again that I would make sure and make this service announcement. That's why I really need to do this. About a week and a half ago, I went through a bit of a down slump. আমার একটু মনে দুঃখ হয়েছে আর একটু সাস্টেইন ভাবে। আমার একটা পেশেন্ট 2 সপ্তাহ এখন 3 সপ্তাহ হয়ে গেছে, কোভিড পজিটিভ হয়েছিল, ওষুধ বন্ধ করেছিল, he stopped his medication, he became more impulsive, he had a diagnosis of bipolar. For the sake of anonymity, let's call him Mr. SD because he deserves that respect and credit. And Jeta Hoy, I guess they had a joint family. He thought they were giving him poison, so he stopped taking the medicine. And in that COVID building, they had a building that someone tested positive, he started wandering also and picking up dirt, putting in his pocket. And he passed away within 2 weeks, actually. And I just want you guys to know, I guess, this is my second patient that I've lost, I guess, through COVID. Even আমি OPD তে কাজ করি, IPD তে করি না, hospital-এও যাই না. But I've lost 2 patients. That would have been preventable. And যারা মুখোশ পড়ছে না, এটা ভীষণ selfish জিনিস করছি আমরা. Because we don't have symptoms or we don't have an issue. I want it to be clear right now, right here. কেন আমার মুখোশ পড়ছি? And it doesn't matter that you know feeling hot, na mane ki gorom lagje. That gentleman deserved to be alive today. And the thousands, the tens of thousands still deserve to be alive today. But amra manchi na, amra eta porte chaichi na. And if you wear it, pori eta right? Jodi ঠিকঠাক pori, jodi ঠিক না pori, এটাও হচ্ছে. But look, so you have to understand why you're wearing the mask. Mask porchi is to prevent other people from getting our droplet aerosol infection. So with that, I'll start. But Amar eta daito chilo in his honor, and he was a very self-made man, very intelligent man, and I really miss him. So RIP. Dedicated to you, sir. So going into mood disorders, amra ki ajke korchi. Why are we doing this? We are doing this because.
I'll just interrupt Dr. Ranjan once.
Yes.
I just want to inform the audience that we have poll questions here in the polls area, and we'll start the polls. So you all can access it and respond to those questions.
So yes, thank you for reminding me. Almost bhul gaye chilam. I got in a moment, in a motion. But I like this to be an interactive session. Whoever's here, awesome. I hope you guys are commenting, shouting out. If you do, Shudarshna or Vijita will tell me what's going on. So please comment. Please be active. Please do the polls. I want to see how many people have had depression before. And I think we just start the poll here.
And I just want to just start with one more thing, that there is a speak option here for the audience. So y'all can just click on the hand, the speak option, if y'all want to interact and say out loud your questions as well, and he'll take it accordingly.
Definitely. And just interrupt me through the thing, otherwise we won't get time. Then you'll have to contact me later and try to find me. So just interrupt me.
So we'll start with the first poll.
So is the poll is the first one? I think I set
Yes.
it on. Okay.
Yes.
Yeah. And you guys can control the poll if you want.
Yeah,
we
sure.
can do it.
So
We'll just
do
start.
you guys know where the poll is? Please answer the polls, please.
We can just wait for them to answer.
Agni.
Right.
And
So I think we are getting the answers.
I think in this stressful time also, if you guys have any stress going on or anything you'd like to talk about or to vent, that's what this is for as well. Obviously, কিছু একটা শেখাবো, but তোমাদের আউটলেটটাও ইম্পর্টেন্ট। যেরকম আমি করলাম এক্ষুনি, খুব হালকা লাগে। So we want you guys to feel light. We want you to feel good. I think SATS Academy, that's why they've actually had me come for a series, because we want to learn how to regulate our own emotions and mind and what's appropriate, what's not appropriate. I think to break that impression.
So I think we can end the poll now.
Sure. Yeah. Okay. We got all the answers. Let me see. Okay. Take it if no one wants to do it. It's no problem. So let's go to the slides, I guess. Start the presentation. Okay. So Good Karma, again, I think most of you guys know about Good Karma. It's my flagship. I feel that it's the most important thing that I've done in my life, irrespective of the accolades I received in America, all the notoriety, all the praise, promotion. I think Good Karma has been the most noteworthy thing I've done in my life. And I think it will be continuing as we develop from the website to the app and making it more of a fluid thing for a one-stop mental health shop and a one-stop physician shop. Next slide. So I always do this because I don't know if we have any COVID warriors or Corona warriors or whatever you want to call them. But pre-COVID, medical professionals already burn out chilo. Mane higher rates of suicide chilo medical professional der moddhe. Ekhon with the recent IMR stats IMC stats that they have said 11% chance of mortality amongst physicians, or 11% mortality rate so far. It's pretty profound, and I think people will start being nervous and those things. So Grover et al. For IJP, Indian Journal of Psychiatry, had already assessed medical students and medical residents in various medical colleges. And what I like to show is that there was already an issue. Now the issue is really on a different level for medical professionals. That's why Ami, Maharashtra Medical Student Association থেকে সব জায়গা থেকে আমি একটা lecture দিচ্ছি এবং the first 2 or 3 visits for a COVID or Corona warrior আমি বিনা পয়সায় করি. So I'd like to, that's a commitment to all of you medical professionals having to face it.
Dr. Anjan, there's somebody who would like to speak.
Sure, please.
Richa? Ms. Richa, can you hear me? Hello?
Is it in chat? Okay, so
I think
while we
continue
figure
if
that
you
while we figure that out, you guys just interrupt me, okay? No problem. But basically, what we found out is because the residents had so much stress, depression, burnout, that they were not shown any empathy from the patients, from their seniors. So this junior staff, with the first year of getting into an esteemed institution, had found that they had a hard time no matter what. আর এই কোভিড সিচুয়েশনের সময় আরো বেশি সো আই ফিল দ্যাট এরা শান্তিও পাচ্ছে না কাজে শান্তিও পাচ্ছে না বাড়িতে because what they're having to do is pretty tough and they're not getting any sort of help. And if we look at the PHQ-9, which is our health quotient index, it measures depression. They were already in a high forum. So now aro beshi hoye geche. And I have those stats somewhere, but I don't have them handy right now. So if you have any questions, please ask me. This is the activities we were able to do. I want to be clear about this. I went to Reserve Bank of India and gave the similar lecture. I had met with Pranab Mukherjee. I had gone to the gym with my gigantic physical trainer. Sir, Dr. Kunal Sharkar, my mentor, and Mituda, who I affectionately called Dr. Shanandan Basu, had done my red ribbon cutting. I saw Avengers with my cousin. There's so many things we did. Charity in Taki, Open Good Karma, went to Darjeeling, did an addiction camp, did a suicide prevention awareness, fought for violence against doctors. We did everything. We were on fire, okay? And then lockdown to hoyeche. So, কয়েকটা জিনিস পাল্টে গেছে. We changed a lot of things up, but it's not like we were less active. We had to be adaptive. So when I say adaptive, I mean that we had to change the way we did things, and most of them were done in isolation the way we're doing it now. Unless you were wearing this type of PPE, you didn't go to the hospital. Online consultation became the rave instead of in-person consultation. Netflix, Money Heist, we also coined the phrase Mind Heist, had a contest of everybody cooking, dancing, joto jinish koreche. They attached Mind Heist to it, and the winners were done. We had competitions. We were able to meet with RJs at different levels. Amra ekta Bangla rap cipher korechi. At the end, you'll hear some of that. And there was a work-life balance thing, and we basically did a lot in regards to it, but everything changed. So our medium changed. That also changed us. Amrao palti gechi. So how does that affect our mind when we are in isolation so much and when we're thinking we're social, but right now I can't feel you guys. I can't feel the pulse of the audience. Ami bujhdeo parchi na ke dekhche ke na dekhche, ki comment korbe ki comment korbe na. I can't even understand that. So with that being said, amar kaj ajke is to make sure tumra erom ho na. Means you don't look like this at the end of the thing. This is someone who's into severe stress or tension, taking over the body and mostly taking over the mind if you see it, and they're having severe depression. So moving on to this, these are the neurotransmitters affected, and we won't go into this very much.
Dr. Ranjan, we have a question.
Please.
From Mr. Anurag Mukherjee.
Acha.
He is asking that he feels stressed, no job security, how to deal with it during this situation, during the pandemic situation. He feels stressed as there's no job security. How does he deal with it?
So I guess the supplemental question is, akun job ache kina? Because it's different for different people, right? So If you're fearing about your future and you have no job now, it's different. I guess it's a little bit more severe than if you have a job and you're fighting to maintain it. So in any case, the stressors are the stressors. What I say about job security and stress and the way it impacts you, it gives you a sense of purpose. It gives you a sense of well-being. So when that goes away, you have to struggle to do the things I showed you in the other slide. Otherwise, you're not going to feel like you've done anything. And it can be anything that gives you purpose. But যদি financial problem হয়ে যায়, এটা অন্য জিনিস। যদি job tension বেশি হয়ে যায় because it's work from home, that প্রতি মিনিটে কাজ করতে হবে, সেটা অন্য stress, অন্য tension. So in any case, I mean, if you give me some more details, maybe towards the end, if you want to talk to me, that's fine as well. But what have we seen with these terms? We have seen that these terms mean that তোমার একটা বিশাল problem হয়ে গেছে আর you need to go see a পাগলের ডাক্তার. So that in itself is very defeating. যদি এটা তোমরা বলো যে পাগল হয়ে গেছো, পাগলের ডাক্তার দেখতে হবে, দেখাতে হবে, I'm sorry, and you have to understand the mindset of the person. ওরা কিছু বলবে না তোমাকে, ওটা তো বন্ধ করে দিচ্ছ ওদের কথা, মানে বলার আগে বন্ধ করে দিচ্ছ. So what I'm proposing is that these are just terms. They don't define your loved one. I'll always be Ranjan. এটা মানে না যে আমি bipolar patient হয়ে গেলাম if I had bipolar. এটা মানে না যে if I had some sadness, যেটা এক্ষুনি বললাম আমার নিজের sadness হয়েছিল. That doesn't define me as someone who's a মানে শক্ত মানুষ না, character flaw, and pagol. These are the worst terms that I've ever heard. যে এটা ইচ্ছা করে করছে, ব্যথা সত্যি নেই, এটা মানে আমি সবকিছু দিচ্ছি তোমাকে, কি করে এটা হলো? These are the things I hear. I'm giving you everything in life. How can you have depression? How can you have bipolar? What is this? So we're going to go over why it happens, what happens, and all these other things. Patients with this diagnosis have an abnormal mood characterized by depression, mania, or both, alternating fashions. And we'll go over the both aspects of things. The abnormal mood may or may not impair the person's social or occupational functioning. Judi impair kore, if they impair your social or occupational, judi young adults are youth, if it impairs your academic functioning.
Dr. Anjul?
Yeah.
I think Dr. Anjul, I think I'll just interrupt you. There's somebody online.
Okay.
We have Ms. Shruti here. She wants to ask a question. She wants to interact. So
Sure. Yeah, interact away.
Can you hear me?
Thank you.
Can you hear her? Can everybody hear her?
No, it's a very light.
It's very light.
Can you hear me? Hello?
Yeah, I can hear you. If you have to, like, jore bolte hobe.
Hello.
Yeah, একটু জোরে বলো, শোনা যাচ্ছে একটু.
Yes. I'll just continue. I have 7 members in my family, and presently everybody's at home, and all the people who are working. In fact, I'm shouting. I have 7 members in the house.
Right.
And
Yeah, I heard you, 7
everybody
members.
is working from home excepting for me. I'm the only one who has to go out and come back every day from work.
Okay.
And at times I have a little bit of guilt in my mind when I
You have guilt in your mind when you come home, right? Huh?
Yes, when I come back and I feel that I may be infecting the rest of them. Yes, as I feel that I may be infecting the rest of the members who are staying in the house. Well, how do I deal with this?
Okay, so but yeah, I'll answer this one, but I'd like to stay on topic as much as possible in terms of mood disorder questions. But ঠিক আছে. You're going outside and you're coming home, you're feeling guilty, and we realize inappropriate guilt, যেটা মানে জিনিস যেটা তোমার কোনো মানে কন্ট্রোলের মধ্যে নেই, যদি তোমার নিজেকে দোষ দিচ্ছ, that is also known as inappropriate guilt. It's also a symptom of depression. We'll go over that here in 5 seconds. But how do you deal with it? You be careful. You make sure they don't get infected. You don't take off your mask for anybody. You don't eat in front of people, honestly. You have to be very, very careful. But again, these are all COVID questions, but yeah, you have to be careful. Very, very careful. And that sometimes leads to depression or leads to a mood disorder. So good question. Thank you for speaking up. Yes, it's different when everybody else is working from home. তোমাকে বাইরে যেতে হয়, সবকিছু মাস্ক টাস্ক পরে। If you look at my getup, it's really silly. এটা আছে, screen আছে, সবকিছু আছে, right, চশমা? But it's the care we take for the people at home. So yes, there's no point in feeling guilty, but be careful. That's the main thing. I guess be careful. And with that carefulness, and with that extra added layer of stress, যেটা already ছিল আমাদের মানে West Bengal মধ্যে and bigger aspect Indiaর মধ্যে, we have to be extra careful now. So that is leading to a lot of more depression and anxiety, especially mood disorders and major depressive disorder. But the key thing is, আবার বলছি, repeat করছি, it's an impairment in social and occupational functioning. That's when you know আমাকে professional কাছে যেতে হবে। আমি একাই বসে আছি ঘরের মধ্যে, আমি বাইরে যাচ্ছি না, কিছু করছি না, ভালো লাগছে না কিছু, then you know that okay, socially I'm having a difficult. I used to be very active, এখন I'm not active at all. Or আমি কাজ করতে পারছি না, concentration পাচ্ছি না। So what does this look like? What are mood episodes? All the way down from major depressive disorder to manic to hypomanic to mixed. And I'll show you in a graphical representation and you'll feel better about it. But major depressive disorder jeta lasts for 2 সপ্তাহের মতো, 2 weeks. Manic episode lasts for around, let's say, 3 to 5 days. Maximum it lasts 1 week, which is like মানে ঘুমটা লাগেই না. A mixed episode can keep cycling up and down, and I'll go over the salient features. I just don't want to give all of it away. Hypomanic can last for 3 to 5 days. And manic usually, besides this country, every other country, I usually admit to the hospital because it's easier to control in a setting or an institution. So the next slide is about the same thing. So
Dr.
if
Anshul, we have another question.
Yeah, sure.
But I'll ask, how to handle mood disorder in kids? Uditi here is asking this question.
Yes, how to handle mood disorders in kids. So that's my specialty. So it's a good question. বাচ্চারা একটু tricky থাকে. You have to have a good parent or a good professional parent-এর সাথে এই জিনিসটা handle করতে. But they're tricky because their symptoms একটু different থাকে. So যদি ছোট বাচ্চা হয়, sometimes they might have regressive behaviors like bedwetting আবার ফেরত আসে. Sometimes ওরা বোঝাতে পারে না, they can't tell you that they're feeling sad. So কি হয়, ওই বিষয়ে they say that আমার পেটটা খুব ব্যথা করছে, my stomach is paining, my this is paining. Why only kids? This happens in adolescence, pre-adolescence, to even adults that are social, emotionally repressed. So part of Good Karma's philosophy is to make people aware and prevent this thing of childhood depression. এটা কেন হয়? আমরা আটকিয়ে দিই বাচ্চাদের, মানে বলার আগে আমরা বলি যে না সবকিছু দিচ্ছি, এটা হতে পারে না। এটা কেন করি আমরা? Why do we do this? I think I said in the last lecture is that we have a lot of anxiety. And when we have this much anxiety, we want that our kids are nothing wrong. So we become in denial. And because of the denial, amra oderke chup korai. But the problem is that once we tell them to be quiet, if they actually have a problem, somebody from the internet or their bondhu keu to shunbe ei jinishta na. So then you as a parent are losing the importance and losing everything, the trust, and losing everything with your child. So the main thing I teach parents is that actively listen. Kotha shono. Ekhon bojachi symptoms gulo, but তুমি যদি না শোনো কথাটা তাহলে তুমি বুঝতেই পারবে না আর ট্রিটমেন্ট তো অন্য জিনিস so sleep and appetite is the main things for children just like the main things for adults so we're going to be going over the sleep and appetite differences in mood disorders and you'll understand that but all I can tell you right now is play with your kids watch your kids if not you'll have to bring them to me তখন আমি খেলবো ওদের সাথে আর বুঝতে পারবো যে কি হচ্ছে simply I do play therapy I figure the kid out if they're very young if they're adolescents though that's my specialty very easy for me to engage with young adults and adolescents if you have any questions please let me know afterwards with your child specific so dekecho a normal balance oh yeah thank you very much for the question so normal balanced mood ta dekhte paccho to it's like this thing and then if you can see the mild moderate depression severe depression hypomania severe mania ঠিক আছে so these ones are this is the most important graph to know আমাদের কি হয় এই লাইনটা বলে normal if there's existing as such a thing so আমাদের একটু দুঃখ হলো একটু ঝগড়া করলাম বরের সাথে না মিসেস এর সাথে right একটু depression-এ চলে গেলাম boyfriend or girlfriend for some of us so it goes down then you go back up to normal when you feel nice again then you have some work stress একটু দুঃখ হয়ে গেল আবার একটু রাগ আর খুশি এরকম করে চলে right a little bit of happiness a little bit of anger and so what happens in depression this line means এটা যদি সোজা হয়ে যায় completely সোজা এরকম this is a little bit of up and down but if it's straight like just like this line then it's almost like parallel to our depressive line that's cut off but depressive line is almost parallel to this line for 2 weeks meaning that amader kichu bhal lage na we used the things we used to adore and love before ekhon ekdom bhal lagche na we don't like it and on top of that moods if you what is low moods has anybody experienced low moods have you guys anybody experienced low moods in the people that are watching because or people registered at least because if you haven't experienced low moods, then it's hard to tell. But I think shobai, almost everybody has experienced low moods. But tar mane na the depression hoye geche. At least major depressive disorder hoy. So major depressive disorder hocche a line ta. And if you have had experienced mood problems, please write it in the box. I like to see you guys express yourself and be honest. Kono lojja nei. These are all again friends amongst you, and you should be able to express yourself. That's the whole point of this. Bacha theke now, from childhood to young adults to adults, we need to all be able to express ourselves, to even senior citizens. So, but it's hard to teach as they say, it's hard to teach an old dog new tricks. So start young. Here's the major depressive disorder. Here's sadness. This could be that my sadness I felt when Sir passed away. This is major depressive. আমি খাওয়া দাওয়া বন্ধ করে দিয়েছি, ঘুম ঠিকঠাক হচ্ছে না, I stopped eating, I'm not sleeping properly, next day I feel tired also. Everything is my fault. সবকিছু আমার দোষ যেটা you asked a beautiful question I think before which is that I feel guilty. Shobkichu amar dosh, but it's not true. Everything is not your fault. There's certain things you have no control over. So a line ta mane amar kichu bhal lagje na ki labh beche thakbe. And you feel really low about yourself. Amar chhara kichu hobe na. Like I don't feel like nothing is going my way, nothing will happen. And so because of that, I become very slow. Even যদি উত্তর দিতে হয় একটু সময় লাগে উত্তর দিতে। এবং if I'm trying to get up out of bed, it's a hard thing to get out of bed. So that is major depressive disorder. Okay? Now if I have thyroid, hyperthyroid, it can go this way, beshi chinta. If I have hypothyroid, it can go here. And we're going to talk about drugs and medicines and all that can affect depression. But I just want to define it first. So,
Dr. Ranjan,
yes, please.
so can we take a poll right now?
Sure, yeah, please go ahead.
Because the question here is, could you deal with your depression? So I think this is a perfect time to ask this to everyone.
Yeah.
So
Okay,
I'll
yeah,
just
sure, please answer.
put up the poll here. And everybody can. Yes. So can we have the answers? Okay. So we can see the percentage here.
Okay,
How
good.
many? Yeah, so it's almost 70% says yes.
Good.
And
Well, not good that you've suffered depression, but good that we have people that have.
yes.
So, depressive disorder, Kintu, everybody probably have had some sort of depression or dysthymia, low-lying depression. But major depressive disorder, it's hard to become this low. But it happens pretty often, and the stats are pretty shocking. Like 1 in 20 Indians are depressed, have major depressive disorder. It's becoming like a more recent phenomenon that people can't even handle their own moods anymore. আর বুঝতেও পারে না যখন depression হচ্ছে. So that's the thing of major
Dr.
depressive
Ranjan,
disorder. Excuse me?
related to this,
Mhm.
yeah. Can you hear me?
Yes, go ahead.
Related to this poll, this question actually, could you deal with your depression? There are about 9% who has said they could not understand. Does the situation usually occur that you have depression and you don't understand, but later you have such symptoms which become severe and then something even terrible can happen? Or maybe nothing happens. Is there a possibility?
Yes. So basically, we really need to understand that there is a type of symptomatology that doesn't follow this. Atypical depression means sometimes you eat a lot and sleep more. That predominantly happens more in females, and they like to eat chocolate during that time. And it's a given fact. It's called atypical depression. There's so many different types of symptoms that nobody ever fits in a mold. So yes, to answer your question, অনেক সময় আমরা বুঝি না. It's a tough time to understand. It's a tough time to do things. It's a very difficult.
Thank you. You can go ahead.
Okay,
So
so
we have more questions. Do you want to take it?
sure, yeah, take them. Let's take them.
How can Shamim Wani here is asking a question. How can one differentiate between stress and depression?
Okay, so good question. Very good
interesting question.
So last part আমরা stress মানে একটা বক্তৃতা দিয়েছিলাম on stress. So stress is the antecedent event to depression. Tension যেটা বলে এই দেশে. When I first came to this country, I had no idea what tension was. Like I was like, what are people talking about? 2 বছর আগে অনেক কিছু শিখেছি, তোমরা শিখিয়েছো. So tension is a very good term though. Tension means the whole body is being pressured. And once your whole body is being pressured, that is what stress feels like. So obviously there are going to be all kinds of stress effects to tension. So if I can go back here, I'll just show you. Actually, I don't know why these were in my slides, so it's a good call. Might as well look at them. Here. So here is persistent stressors and negative emotions, and leading to unhealthy behaviors like smoking, drinking, poor nutrition, sleep, and basically doing unhealthy things to deal with the stress and causing this to worsen. And then ki hoy, stress hormones, cortisol mostly release hoy, and it affects your heart, affects your immune system. Jeta shobai COVID korche, the immune system ta affect kore. Autonomic nervous system, and unfortunately I think that's what happened to my patient as well. Immune system ta suppression hoy, autonomic nervous system, headache, hypertension, but most of all, একটা depression hote pare because it's the same neurotransmitter in play. So it's a result of stress or tension. It's one of the biggest factors that causes depression. So one or the other. The symptoms, jeta ami bolam major depressive disorder, MDD, jeta bole, oita ekta symptom cluster, jeta joto ekhuni bollam, like all those symptoms, low moods, not finding interest in past things, inappropriate guilt, excessive anxiety, inability to sleep, next thing feeling tired or fatigued, no energy, and suicidal thoughts. The next thing I discuss now, I hope that was good. The next thing I discuss now, though, is going to be I have to get this out because it's important for most people to understand the difference that you can still have depression but still not look like this style of depression. This is also something called hypomania. So if you have a thing called bipolar disorder, around 16 to 20 typically, aage tomar depressive episode shuru hoy. It's a genetic thing and we'll discuss that later, but hypomania key symptoms. Hypomania feels like you have excessive energy. Okay? Excessive energy. So you still have depression, but it's masked by this excessive energy. So I want to show you what it looks like exactly. So let's go over the stats real quick. 56 million Indians, about 4.5%, around 5% of moton suffer from depression. Eta WHO boleche, eta amader nimhanzo boleche. So please understand that it's very big. Oy jonne our suicide rates are higher. So, and imagine 7.5% of people suffer from major or minor mental health disorders. These are documented. Like, so these are all the people that have said, yes, I have some sort of mental health disorder. But what about all the, mudi dokans and all the, farmers and all those things? We don't know. They don't report, right? So so we have to understand that this is just a very rough figure and a very low figure. That's the scary part of mental health. And the scary part is that during this COVID crisis, this is even ballooned higher because I'm seeing it. And I didn't want to get popular this way out of necessity. I wanted people to change and want to use mental health, but this is a dire now epidemic. So like I said before, problems with eating and sleeping, guilty feelings, loss of self-esteem, anxiety, irritability, loss of energy, trouble concentrating, thoughts about death, and sometimes suicidal plans. These are just terms. If you don't meet the full criteria of major depressive disorder, which is the first two things I said, low moods and loss of interest, plus chatte jinis or tinte jinis, 3 things, then you don't meet the actual criteria, but you still have some sort of depression, and I still have to treat the symptoms. So back to yeah, go ahead.
Just give me a second. I think we have Mr. Raj Kiran online. Hello.
Okay, sure.
Mr. Kiran?
I think if they type the questions, it might be, or if they like ask you.
Okay, you continue, then yeah, he can do.
And then you can ask them. Okay, so
yeah.
The current prevalence, like I said, depression is pretty high. Bipolar, a lot of other people don't even like to admit. Mane shikaro kore na je amar bipolar hoche, amar chele bipolar hoche, because now people know the term. And in a very heavy marriage-friendly, marriage-promoting country, that if you have some sort of mental illness, that something's wrong with you, it's not a correct thought. because I also like to give this example. If your wife or husband to be or whatever it may be, boyfriend, girlfriend, had high blood pressure or diabetes, so this is a manageable disorder if you guys don't judge and actively treat, just like diabetes is, right? So in that case, the prevalence of bipolar, again, take it for a grain of salt, but the 1 year prevalence is 0.5 to 1.4, lifetime prevalence is up to 8%. But honestly, I feel like it's more than 30 to 40 per 1,000 population at least. And we see this a lot. We've seen more and more of all the suicides that have been accounted for be because of bipolar, not just because of unipolar depression. Keno bolchi eta? Because unipolar depression jodi hoy, if you have unipolar depression, just feeling low, you don't have the energy to commit suicide. But if you take famous cases like the recent Bollywood death, tragic death of SSR and those things, they had the energy and they had the motivation, if you will. It's a bad term, but they had the motivation to hurt themselves. So I'll show you why. And this was done by, this study, by the way, as less number as it is, was a good study done by Swarupa Chara in India and the Archives of Mental Health in 2018. So it's the most recent. Bipolar disorder, what do I ask? The best indicator is bari loke ki raga che. Means, do you have anger in your family? Do you have sleep difficulties? Has anyone attempted suicide before? And the responses you get would be shocking to you. That somebody says yes, somebody says no, but then you find out that their own mother has tried to light themselves with kerosene on fire. Okay, so that's how much in denial we are of mental health issues in this country. Positive family history 20% এর বেশি আমি মনে করি, আবার বলছি এটা because কেউ স্বীকার করতে চায় না এই জিনিসটা. Sometimes we hear the stories like Amar Kaku used to like to bathe naked in the pukure majratire. They used to like jump in the lake in the middle of the night and be active. You know, those things are there. All these life stressors that we're talking about, which was a good question, cause the graph to either go up or down in bipolar. Upor jabe nole niche jabe. Any tension, biye tension, porikar tension, bacha hoar tension, promotion hoar tension, any tension drives a bipolar person up and down. Bipolar people are the smartest people that I know because their brain, for what it's worth, mine is pretty fast, but their brain is even faster than mine. It moves so quickly, acta theke acta, you can't even catch up, and it's in their head. So there are many episodes can happen without obvious cause. Definite hypersensitivity occurs from early childhood. Strong link ache OCD shate, and when we do OCD disorders maybe in the future, then I'll tell you about that. So this is the meta-analysis. Here's the real important things. So remember I showed you up phase ta? Up phase ta jokhon hoy manic mood behaviors. Mane beshi khushi, euphoria, beshi nijeke bhava, like grandiosity. I feel like I'm on top of the world. I'm like Sadhguru now, you know what I mean? Like I can do everything. I'm like a life coach, I'm this, I'm that. That's grandiosity. That's in hypomania grandiosity. Now, if that is unchecked, these symptoms, it can lead to, from Sadhguru to actually becoming Shiva or Krishna or Jesus or Allah. It doesn't matter. You find this in hypomania, and psychosis means that I don't know what's real anymore. I mean, shotti ki ar shotti na jani na. So it makes you feel like unstable. Okay. So that means that if I'm very much psychotic, I don't know who I am anymore and what's going on. And in regards to grandiosity,
I think,
yeah.
Do you want to continue? I think Mr. Raj, he has joined the forum. Hello, Mr. Raj.
Yeah.
Can you hear me?
Yeah.
Go ahead, Mr. Kumar. Go ahead.
Yeah, this is Raj Kiran.
Oh, Mr. Kiran. Yes.
Yeah, go ahead.
Do you hear me?
Clearly.
Yeah, we can hear you.
Yeah, thank you. Yeah, how to overcome this guilt depression, depression out of guilt that we did something wrong to someone. Even they're speaking to us, even they forgive us, but still a person will be having that depression, the guilt depression. How would we overcome? This is not about COVID question. This is about psychologically a person who suffers from the depression out of.
And I don't mind the COVID questions either. It's just it doesn't go with the theme. But guilt, inappropriate guilt, jeta ekuni bolla, and what inappropriate guilt jeta abhi bola tha, means that I have everything that's my fault, but the person has already forgiven or forgotten. So in that case, I look for other symptoms. I look for these symptoms here.
Yeah.
I mean, sadness, lack of interest, sleep and appetite disturbance. And then I ask the person, what should we do? Would we like to do some sort of counseling? Would we like to see if it just goes away on its own? Or would we like to see if there's anything influencing? So that's in a big part of my job, is to look at what medicines the person is on, what medical issues they have, and what psychological traits they were given in their environment. A lot of people develop defenses and such. So it's a bigger, I guess, bigger answer because everybody's different. And I have to individually look at it like a detective and figure you out. Like, why are you having inappropriate guilt? For what reason? Or why are you feeling guilty? Maybe you did something really bad and you're feeling guilty, but why can't you let it go? So those are things that we have to investigate.
Okay. Thank you.
Thank you. Yes. So in regards to manic behavior, we just went over depressive again, but manic behavior is euphoria, grandiosity, pressured speech, impulsivity, lack of concentration, excessive libido, so hypersexuality in the height of the phase. Recklessness means what? I can give my shirt to someone if I'm feeling manic. Like right then and there, if you need a shirt, here, take my shirt. Take my gold, take my everything, take my watch, take whatever you want. Means that I'm so reckless and I'm giving everything to everyone. Social intrusiveness, diminished need for sleep, all these things are there. So basically, if you look at it, ghum lage na. I'm very active. 2 ghanta ghumiyechi 2 hours, but the next day I'm on fire. I can't be stopped, or in my mind I can't be stopped. But actually I'm kichu beshi korchi na, but I think that I'm doing so much in life. Okay, that is hypomanic. Or thinking I'm higher than anyone, everybody's lower than me. Not in a Trump way, and I'll show you a slide of that later. I like picking on our number 45, actually, U.S. president. But I think that everybody can say that there's some narcissism in other people. But I think oita confusion take. Narcissism versus grandiosity. Grandiosity means that our mind ato tatari kaj korche and ato khushi ami, ato happy that I'm feeling very high on life about myself. Okay? And then as I'm feeling so high and high and high, it's like a epilepsy. My brain is working so fast that I'm becoming psychotic. I'm like I'm paranoid. I'm grandiose. I'm feeling like I can hear things that are not there at the end stages. I'm not end stages, most severe stages. I can cure all of this, but it takes me a while once it gets to the manic side. Cognitive symptoms are the worst because they kind of feel disorganized, memory loss, they don't feel the same once they're that sped up. But they feel that they're handling things well, but they're actually being rude and self-absorbed, and people think that you're actually pretty selfish at those times. So back again here, like I said,
Should I ask another question?
Yeah, sure. And ekane mixed state. So now we've learned about all the definitions. Okay. Yeah, please go ahead.
Mr. Rajat Bhattacharya here has asked a question: how to speak with a bossy individual and not being affected by his rude behavior? I think what he means is a dominating natured individual.
Yeah. Good
How
question.
do you not get affected by the rude behavior?
So if they're bipolar manic, there's no way you can deal with it because it's every day is a new day. You might not see that. But if they're narcissistic and they have rude behavior and bossy or like very entitled, I think the way to deal with that is to kill them with kindness. Like, I've always been under the impression of that, look, not everybody is going to like you, and nor do they have to like you, but they have to respect you. I'm very much under that impression. I treat everybody from rickshawala to everybody as my equal. And I think you should employ that and show that person that you're doing that in front of them. The only way is to demonstrate is to show them and kill them with kindness, really. Is that no matter how bossy you're, just be like, yeah, okay, cool, like, and take it easy. If they get mad and start yelling, I mean, document it and send it to HR, right? But you can either impose real aggression from them if you're very nice, which again, then you can document and send to HR, or you can actually show them and embarrass them, lajja pabe, that you are interacting in such a nice way and they are not. Never resort to their level of bitterness or thing. Even if you can't take it anymore, I used to think of this, if you can't do breathing exercises, and I taught that last time, 3 seconds in, 3 seconds out, you come back a whole new person, acclimated for it. Then go to your car or go to wherever you are and shout, and then come back to your place. I mean, just let it out, let the frustration out, come back, and then deal with the guy or girl. Does that answer it? Is that good enough, or should we?
Thank you so much. I think there is another question
Sure,
by Ms. Shruti Ghosh. I'm asking this question because it's kind of similar.
Okay.
How do we handle frustration when a boss who shows that he's always right? I think she's asking in an office scenario or in a work scenario, if you have somebody who is...
I think I just answered that question. Just
Yeah.
answered it. Thank you for the question, Shruti. Very nice question. Sir just right before that asked the same question. I would document it. I wouldn't instigate, but I would be kind to a fault. I do that often, actually. I think a lot of people know me on this forum, so they've seen me operate. I'm kind to a fault, and then people think or don't think that I'm getting taken advantage of. That's their own thing, but I know what I'm doing. I think you should know what you're doing and always be in control of your body and your emotions. So that's the only way to win. Don't let them win, which is to poke you and become angry and to make a scene. I would never do that. Okay? If that answers it again.
Thank you so much.
Yeah, there's different causes of mood disorders, like from corticosteroids, like which they've said is good for COVID and intubated patients, may cause hypomania or mania, may cause psychosis, may cause depression. Hypertensive medications could cause depression. Thyroid medications could cause hypomania or depression, depending on how much you're giving. And could even cause panic attacks. So there's different medicines that's what the difference between a psychiatrist and a psychologist is, that we went to medical school to study all the various causes of biologically what can cause any type of mood disorder, psychotic disorder, anxiety disorder, childhood disorder. And unspecified mood disorder means just they don't fit in a particular category, like I said, and they have all these issues. So here are some of the medicines that we use to treat it. These are in American formats for my old system, but most commonly here is the Nexito. The problem is that you have to really figure out if somebody has bipolar or not before you give these medicines, because if you don't figure that out before you start giving the medicine, Paxib CR, Sirta, D-Venis, Venla XR, Citalo, Citla, Nexito plus Nexito, Prodep, Fluvoxamine CR, Fluvoxin CR. These are all SSRIs, and I just mentioned all the brand names of India. But if you don't give it, you can actually cause the person to, let's see if I have another slide. Oh no. So you can actually cause the person, remember in our graph, to go into mania. So here's the board, here's the line, here's depression. Depression to thik ho gaya, but I'm making the person hypomanic if I'm giving them the wrong medicine. My job, artistically, especially for bipolar patients, is to make sure ekhane ashe ar ekhane ashe. Ekhane niche napte parbe na, ekhane beshi uchu napte utte parbe na. So I have to make it, keep it in this baseline of up and down. So that's the hard part, and everybody's different. So it's kind of like become an art to choose what for what patient, and try to figure it all out from age 6, which is the lowest I've seen in my life in the US, and because they have been in a methamphetamine lab and all kinds of confounding factors. But age 6 to age 90, right? How to treat depression, bipolar, and how to figure it out, and how to make sure that somebody understands what I'm doing and what side effects can happen, and why I even tell them side effects. Keno boli, keno bhoy dekha, jeta bole bhoy dekhano. I want our patients to be treated like I would want to be treated. If I'm sitting there and somebody gives me a medicine and I don't get explained the side effects or what can potentially happen, or you have no ability to contact me, amar sathe jogajog kono nei ar kono mane upay nei amar sathe korte, tale to, you know, what happens then in that point is these medicines can cause side effects, or they can be continued for too long, because we also have this thing as remission. So when the depression symptoms go down as a calculation, after 6 months, we have to reevaluate any medicine. We should stop the medicine. We should see, can the person deal with the life on their own? So the first one is called an SSRI, serotonin, body theke chole jay tatari. So what we're doing is keeping serotonin in our body. Same with noradrenaline. Noradrenaline leaves our body very quickly. We're keeping the noradrenaline in. So those meds are Benla and Divenis. Okay, and these are the older school medicines, and you might recognize them, right? Elavil is a pretty common brand name here. Amitrip, and they're discontinued in the US, is what I try to tell everybody here. They're like, you know, they're not good medicines, purono medicine. So I don't really like to use them, but these ones I definitely use a lot.
Dr. Ranjan?
Yeah, tell me.
I have a question
Please.
that if somebody is having bipolar disorder,
Sure.
and like he or she has to take a sleeping pill?
So good question. First of all, they're not sleeping pills.
Okay.
ওটা মাইন্ড থেকে চলে যায়। স্লিপিং পিলস হচ্ছে কয়েকটা জিনিস আছে। সো ট্রাজোডন একটা স্লিপিং পিল বলে, জাস্ট এটা যেটা ট্রাজোলন বলে। তারপরে কয়েকটা আছে মানে জোলফ্রেশ, আরেকটা কি আছে জোলফ্রেশ এর আরেকটা নাম।
So is it like from mild to stronger ones, like according to the?
Yeah, but it's not. But again, the side effect is sedation. Side effect khide pawa, but it's not like the medicine is designed to like give you sleep. It's designed to give your brain rest, so it doesn't become manic and unmanageable and psychotic.
Okay.
You have to sleep 8 hours a day.
So if somebody is not sleeping, maybe 8 hours, so in that case they should take it regularly?
Yeah, definitely.
Okay.
Definitely. Like, so why am I even telling you guys this? The 3 things, I have to go back to the graph and to explain it real quick, because I just want you guys, this is the most important stuff where, you know, so Jeta bolam, SSRI, SNRI, right? If you have depression, it works great. If you don't have bipolar, and sometimes it makes you lift it a little bit higher. But if you have bipolar, and I start treating you for depression only because I didn't ask your family history, আমি ভালো প্রশ্ন করলাম না, then a rag, a দুশ্চিন্তা, a obsession, a খুব খুশি, নিজেকে ভীষণ মনে করা, all those things worsen to the point of psychosis because I've given the wrong medicine. I've not done my job and asked the right question. Understand? If I don't ask the family history, if I don't ask this, so my job is to protect this smart dude's brain. Bipolar is smart. Depression not all the time is high IQ, but bipolar definitely is. So what I'm trying to do here is protect this guy's brain or this gal's brain from coming here. Because if it comes here, and these medicines all have side effects, but I have to balance risk versus benefits, right? So my job is to bring this guy down of all symptoms, not just the decreased need for sleep. Okay, Vijita, not only just the decreased need for sleep, all of the symptoms.
All of this.
Rag, this, all those symptoms, everything comes down.
Right.
And if problem is though, good question, is that if it goes too low, that's another issue.
Right.
Right. So
That's why
my
I
job
asked you
that's the hardest part of my job, really, is to make sure that the person's is just traveling this right here, the normal quote unquote, the one that everybody's not pago. But honestly, ektu beshi ektu kom hole na, then you can also have a severity that is demonstrable. So I don't call everybody a patient or mental health patient or pago or whatever. I feel like we're all patients in a spectrum type of way. Some ektu beshi ektu kom, right? So we're all patients, right? So that's why I'm saying that please eliminate from your vocabulary ghumer oshud. Because like I said last time, benzodiazepines, right? Ghumer oshud causes us to be depressed. So those are just some of the things that I taught you last time. But here, if I give you ghumer oshud or alcohol, next din that tomorrow depression ho jabe. But
so you can only at least judge that when should you take the medicine and when you should not.
Exactly. And you should take it regularly until I say, because that's what
but there are patients like who doesn't want to take it, and they keep it and they feel that they don't need it.
Yeah. A lot. Well, that's why so grandiosity maniki. I know more than the doctor.
Yes, right.
I know more than my medical professional friends. I know more than the therapist or the psychologist. In fact, I'm
Right.
That's what grandiosity means.
Right.
If I start doing that in your guys' field, right, then you're gonna be like, what? You don't know more than me about this. Like, you might know something.
My problem. How can you know more than myself, right?
Well, yeah, I think that's the main thing, is that
That's the main thing.
they অবাক হয়ে যায় যে 20 বছর আমি এটা করছি, that I can analyze them in 30 minutes, that also online, and figure out what they have by watching them. That is a source of mystery, I guess, to a lot of people. But I'm promise kori hat kori na, numerology dekhi na. So I just observe things and try to get the best things out of them and learn about their thing. And you can only do it not in one appointment, but you can get most things in one appointment.
Most things, right? Yeah. Thank you very much.
Yeah, the dangers now. We're getting to the dangers, guys. And I think we're in an hour mark, so I guess I'll be quick, and so we can ask questions and wrap up. But this is the problem. Age 15 to 29, we have the highest suicide rate in the world. I think I mentioned that last time. The reason I'm good karma, kulichi, the reason why I'm in India, partially is because of the passion I have for decreasing our suicide rate. Aro beshi hote cholche, because these mood disorders, especially in places where it's not acceptable to express yourself. Gram onchole hok, some grams are much more progressive than amader shohor ar shikito manusher. So those people also have problems with social emotional expression. So as this increases, and as this economics, I think the first question was really bang on, is as this economic issue increases, we're going to see the rates of suicide go up. When farmers have to give up their own lands to pay, say, a Bandhan Bank or any bank for that matter, then you're going to see the rates go up. It's going to be in an epidemic format like COVID is. So that's why I'm here preaching to you guys that please keep your loved ones and families safe. Let them express themselves. And if they have something issue, online, let's send them online, talk to somebody, or you talk to somebody in their behalf. I mean, get them out of the slump is the main thing. Okay. So look at the percentage actually globally in the world. We carry the 36.6% of the world's 25% of the world's suicide deaths in females, almost 18 to 20% of the males, whole world population suicides. So in the world population wise, we carry around 16% of all suicides, and 15 to 29 we're on the highest range. আমাদের উল্টো হয়ে গেছে compared to the rest of the world. And this is just shocking stats, all of the global stats though. 1 in 6 people aged 10 to 19 years suffers from depression. Mental health conditions accounts for 16% of the global burden of disease and injury in 10 to 19, if you guys are epidemiologists. Half of mental health conditions start by age 14. Usually, most of them go undetected or untreated or lokano, hidden. Global depression is one of the leading causes of illness and disabilities. Suicide is the 3rd leading cause of death amongst 15 to 19-year-olds. So not addressing them is not an option. We have to address the situation. So if you look at this, a lal area gulo, this one, Karnataka, especially Tripura and Tamil Nadu. So those 3 places, if there were countries, would have 1, 2, and pretty high itself be on the radar. I think this would be the 3rd highest country as itself for suicide. Tripura. So and look at these places, some of these places that are high, like West Bengal, they don't have addiction, and addiction plays a huge part in depression, but they don't have a lot of addiction in West Bengal. So we have to figure out why this is happening in our kids. So we did this stat already. Any questions, guys? Are we doing good so far? I think we should possibly play the song. First, before, is that okay? Can we do that? Take a break and play the song?
I think I have a question.
Sure, go ahead.
How to control anxiety, which I'm experiencing while I'm working from home in a lockdown scenario?
Okay, so anxiety was the last topic, but yeah, anxiety control depends a lot on sleep. And if you sleep well and you understand that your body is feeling anxious and the symptoms that you have, you either, if it's not so far gone, you can either meditate, do deep breathing exercises like I taught last time, and do it that way, control it that way. Diet and exercise is very important. The 5 ways of wellness, basically, I think you guys should all get an email copy of that. But the 5 ways of wellness is important. Is that okay, or should I expand on it some more?
Yeah, that is fine. Thank you. There is another question from Uditi here. What are the triggers of depression or mood disorders? That's what she's asking.
The triggers. So this is a good slide. So right now, here we are. This is my job at Damarkat. So biological factors I just explained to you. Family history, genetics. Bipolar is often genetic. They said 20%. I feel it's higher. So biological factors are very important. What you're putting in your body, if you're smoking ganja, if you're drinking, if you're taking pills, what is going in your body, basically. What are your symptoms now? What is your family history and your genetic makeup? Okay, that's biologic. What disorders do you have? Do you have rheumatoid arthritis? Do you have SLE? Do you have asthma? Do you have anything from a childhood? So psychological factors are how you tend to deal with things. And social factors are the triggers that Uditi is mentioning, are your long-term, so chronic stressors, social factors, and acute social factors. So acute would be this recent lockdown and this recent blow-up of COVID cases. Chronic stressors would be that maybe your parents fought in front of you when you were a child. Okay? Following? So, and then as a result of that, you might have had the psychological defenses of getting their attention, playing a victim role, becoming sick, or being humorous, or breaking the monotony of the house. So that is how we investigate someone in 30 minutes. I kind of ask some pointing questions and figure it out, but these two, Eduto especially, ektu shomoy lage to figure it out. But yes, triggers, all these result in triggers, and this makes you more vulnerable to a mood disorder. It can take আসছে stressটা, ঠিক আছে? And it can take a protection আসছে যে বাড়ি, maybe your husband or wife is protecting you and making you feel nice, or maybe they're adding to your stress, whatever it may be. So the vulnerability then gets chipped away, boom, you get a mood disorder. Simple as that. Okay?
Thank you so much.
Yeah. Is it so
I think
can we play that play the last
we
thing
can,
before we get out of here?
I think we have a question, another question.
Okay.
Mr. Aditya here is asking, an obstacle to people seeking treatment for mental health disorders is reluctance to taking psychiatric medications due to side effects such as sedation. How do we convince those in need to actually seek a psychiatrist?
Yeah, very good question. So the way I do it is that I let the person know that their body would usually get used to it, and if they don't, they have to communicate and we change medicines. But if you don't have a amenable psychiatrist, which there are plenty in the city, if you don't have an amenable one though, that it becomes difficult because you might have had only একটা chance শুধু ছিল, one chance you had, and you blew it because you put the person off with a bad mental health provider. It could be anybody. It could be a psychologist, it could be a psychiatrist, it could be a social worker, it could be anybody. But one chance you had, and if you blow it, then it's very hard for you to get back on that thing again. So sedation, আমি যেটা বুঝাই, sorry, and what I teach the patient is that your body hasn't slept well for, say, 2 months. You're catching up, and if after you catch up, and I feel you've caught up in this next 4 or 5 days, if it's still happening, then I will change the medicine. But if not, and it's working great, and that's your only complaint, that you have sedation and you're not sleeping 3 hours and very energetic, then too bad. That's what your brain should be doing, and I know you feel less energetic, but it's still above the baseline. I mean, grafta that guy. You're still above the baseline. You're still not below the baseline. Until you get here, I'm not going to talk about side effects. You're still here. So it's just মানে সুন্দর করে explain করতে হবে. If you don't explain it, then people won't understand what's going on in their body. I like to even show the graph in the beginning of our appointment and say, কোথায় আছো আজকে? Where are you on the graph? Then they say, Doc, I'm actually right here. I think I'm in a normal state. What do you think? Then I analyze them and see what they're doing. So it's just that communication, I guess. You have to communicate.
So Dr. Ranjan will take last 3 polls then?
Sure, yeah, go for it.
Yeah.
Polls or whatever.
So this time the poll question is, did you avoid your depression? So we're on. Okay. So we are getting more response, and yes.
Look, and I like to say this, I don't like to jam medication down anybody's throat. It's a voluntary process to us working together to make the person feel better, to understanding that it can become more severe. and that 6 মাসে পরে reevaluate করতে হয় or 3 মাসে পরে, depending on the patient, and stop the medicine to see if they actually are better or not. But this doesn't happen here. People don't have a good record of kokun asche na. So that's why this app and the website is very good, because it tracks it for the physician.
So it's like the depression, this episodes will not come once, right? It may come again.
Yes.
So we should not
Mania
avoid.
and depression keep happening, like your blood sugar falls, your blood pressure falls. It's the same thing. It's a chronic illness that comes up and down. And if it goes too up, like marriage time, like I said, exam time, then I have to bring it down again, then test the patient to make sure that they can handle the life stress or tension.
Right. So we'll just end the poll here. So we got 44% of yes and 33% of no. And people could not understand is 22%.
Okay.
So, yeah.
So the 3 things that SSRI had, SSR, and all the people that have...
actually avoid depression?
Yes. Many people actually avoid
Why do
depression.
actually people avoid depression?
Sure, yeah, it's hard to deal with, actually. So, but if you don't deal with it, again, let me tell you, the 3 dangerous combinations: rag, jeta tej, right? Dhorjo ta chole jay means no patience, impulsivity, and suicidal thoughts. Why are these the 3 most dangerous things? Suppose I'm in front of the metro, about to go wherever. I have bipolar, hypothetically, and I am in a hypomanic phase, but I'm having a mixed state. Like, I feel not so good. My boss has been on me. Then I get a call that your project hasn't been done and the client is upset. So instinctively, I throw the phone. Out of those 3 symptoms, anger and impulsivity, and a little bit of sadness and suicidality, right? I throw the phone, and then I realize life isn't worth it. Metro's coming, I just jump. That's what happens. Just like that. If I don't educate you guys about bipolar, you'll never be able to stop it, the suicide rate. That's the whole point of me educating everybody about this.
Right.
That's how quick it happens. That's how easily it happens. And that's how you avoid saying ghumer oshud, ato sedation, mental patient. All these things are counterproductive in what we're trying to do is stop suicide. Ekdom ulto jinish hocche. So we want to make sure that the patient feels comfortable and understanding, ami tomake eto bhalobashi, please doya kore oshudta khawar bolo. It's okay. Just take some days off work. Dr. Ranjan or any other doctor would write you a certificate to take some days off, and they have to, or the month. So it's just the same thing as any other illness.
So we'll go for the next poll question.
Sure, you can do it.
Yeah, it's were you embarrassed to share with someone about your depression? So that's the question. So I'll start the poll. Right. Okay. So we are getting answer yes more. That is 60% of people are saying it's yes.
Okay.
And 40% is saying no.
Mm.
So people are embarrassed to share. So in that case, what they can do?
Yeah, I mean, the thing is that 21 people, if you're embarrassed to share, that's humorous to me, because I don't think anybody's judging anybody. This is the whole point of this. So I mean, if you guys are embarrassed to share, then there's no hope to lower the rate, because we have some of the most learned people in here.
Right. So we'll just end the poll here.
Yep.
And we'll take the next question.
Is there a question?
The poll question is, it's, did you feel...
Yeah, I think if they're not wanting it, then I think we don't have to do it.
Right. So did you feel people will judge you?
No, there's no point doing it. Like,
Right. So if they're already saying yes, right.
there's no point doing it. Like,
Right. Okay. So we are not taking this poll.
I think someone wants to speak, so we can just wait for 10 seconds. She'll join the room. What if
So till she joins in, I'll just ask Dr. Ranjan that what could be our take-home message for today?
take-home message is to not be judgmental, to spread awareness, to be open and honest. We have the highest rates of sexual assault and rape on women. We have the highest rates of suicide amongst young adults and teenagers. That has to stop. So for that to stop, we need from youth, and now because of all homeschooling, we need to be ever so mindful that from us as job as parents has become tougher. So teachers are not the only people responsible now. You should have already been responsible, but now it's your job to teach social emotional learning, because just academic learning is not everything. And the last thing is make sure everybody has access to mental health.
I actually have a question as well.
Go for it.
In a scenario like this, when we're working from home and we have our family and everybody around us, though we're always trying to work in our own space, how our mood sometimes, there are mood swings, and sometimes we're not able to work, sometimes we're distracted. How do we handle that? Is there a way? Or
I mean, yeah, I mean the moods, right? If there's situational depression,
yes.
I mean, people do various things. They listen to music, they talk to their friends, they vent out their frustration with being at home. That's why I believe in the 5 ways, is that you connect with others, you try to make sure that you appreciate things that are happening at home. Like I said, kill them with kindness, no matter what the situation is. And if the moods get so bad that you have experienced a major depressive disorder, and I would hope that they would reach out to a mental health professional.
I think we can take this last question from Shamim here. Up to what level non-pharmacological approaches are going to help?
They help the most. So there was a study shown that if you take depression and anxiety, what's the highest form of treatment? And CBT actually beat medicine. So what does that mean? The first thing that is the best thing to do is medication and CBT, cognitive behavioral therapy. The second was cognitive behavioral therapy alone. The third was medication alone. From that I get, though, if I'm not doing a CBT or cognitive behavioral therapy a certain standardized way, then I'm not improving the patient to that degree. I'm just saying I'm doing it, but it's not being done. Okay. So if you do it in a pure form, you can actually beat medicine management. But both together is the best. Why? Like I said, you have an impairment in social and occupational functioning. So if I start cutting you open, suppose I'm a surgeon, the therapy or counseling part of it is the surgery, and the medication is anesthesia. If I start cutting you open without anesthesia, you might start bleeding over your boyfriend, over your spouse, over your girlfriend, over your missus, right? And you might really give them a hard time. I don't know. And if you start bleeding at work, you might get fired. So that's why I say medication and therapy at the same time. You have to know when to take away, and you have to know how to continue this therapy or stop it.
So I think we have the last question and then we'll end up here. Shruti has asked that at times a depressed friend calls to share. How should we respond? And after all of us are not as good a speaker or a counselor as you are. This is a question, good question.
Nah, there's this gross shortage of mental health professionals, all over India and all over the world actually, especially for children. So that's the only reason why I am that popular. But I think that the way you peer-to-peer, where I was going with that, peer-to-peer support is tending to be the most likely thing that the person goes to first. So if they don't get some sort of resolution with peer-to-peer, tapore professional ke seek koro. So peer-to-peer, what do they teach you in that? You can go to Columbia University. I have actually peer-to-peer guidelines, and I teach that to other college students that are trying to have zero suicide risks in their college campuses. But listen, main thing is that listen without judgment. Listen without judgment. Don't dismiss the person. Don't obechara them. Don't sympathize, but empathize. Amajudi hoto. Let me jump in their shoes. Let me understand what they're saying. Mane protidin jhogra shunle etao hoito hoto. Or jump in their shoes and figure out what they kind of might be feeling. And then don't ever, if you're a therapist, right, you never give advice. But as a friend, you can. Remove yourself from the situation. Go to your room. Listen to some music. Do this, do that. As a therapist, I bring that out of the person. But as a friend, you can certainly suggest. I do all the time to people, my friends, my close ones. So I would make sure that you suggested things that make sure that avoid it for now, but then process it with you while it's happening. But when they're alone without you, they should be able to do things without you.
Thank you so much.
Yeah, thank you guys.
I would just like to tell the audience that feedback will be sent to you on email. You can send your feedback and you'll receive your participation certificates. Thank you, Dr. Ranjan, and thank you, the audience.
Thank you, Dr. Ranjan, for your time and this session.
Thank you.
So, thank you. Thank you very much.